Today, we're going to talk about a period of time that is so incredibly critical, it can literally shape a person's entire life. It's a concept that goes by the name the golden hour, and it all happens right at the very beginning.
So let me just ask you this. Think about all the hours you've ever lived, and all the ones you have yet to live. Out of all of them, which one do you think is the most important?
The answer might actually surprise you. A ton of evidence suggests it could be the very first hour you ever experienced. I'm talking about those first 60 minutes right after birth. They are so profoundly impactful, they basically set the stage for your long-term health and development.
And this whole idea is known as the neonatal golden hour. Now, what's really fascinating here is that this concept didn't even start in a maternity ward. Believe it or not, it came from trauma care during the Vietnam War. Doctors realized that the first hour of care for a wounded soldier dramatically, and I mean dramatically, affected their chances of survival. It took decades, but neonatologists eventually adapted this exact protocol for the most vulnerable patients you can imagine, newborns, and especially the premature ones.
Okay, so this golden hour is built on a few key pillars of care. We're going to start with the one that has probably seen the most radical shift in medical thinking, and that is how we handle the umbilical cord itself. For the longest time, the standard thing to do was to just cut the cord immediately after birth. But here's the kicker. That's actually a pretty recent and pretty misguided invention. If you go way back to the 18th century, Erasmus Darwin, yep, that's Charles Darwin's granddad, he argued that we should just wait, let the cord stop pulsating on its own. It took the medical world over a century to basically do a U-turn and realize he was right all along. So why is clamping that cord right away so bad? Well, think about it like this. For 9 whole months, the placenta is the baby's set of lungs. It's doing all the breathing for them. So in those first few moments of life, the baby is still counting on that oxygen-rich blood from the placenta while their own lungs are just starting to fire up. When you clamp that cord instantly, you sever that lifeline. This can trigger what researchers call a silent shock, a sudden stressful drop in blood pressure, heart rate, and oxygen. It puts this incredible strain on a brand new little system. And when you put the two approaches side by side, wow, the difference is just night and day. On one side, you've got immediate clamping, with all its risks, that silent shock, anemia, heart instability. But on the other side, just by delaying, we're talking 30 to 60 seconds, that's it. The baby gets what's called a shock-free birth. They get a full year supply of iron, a vital transfer of stem cells, and a much, much smoother transition into the world. And get this, studies have linked this to better brain development down the line. The takeaway here is that this isn't just some minor adjustment. It's a completely different and way better way of welcoming a baby. And to really put this into perspective, just waiting a minute allows for a blood transfer of up to 100 milliliters for every kilogram of the baby's weight. For a tiny newborn, that is the equivalent of a massive, life-sustaining blood transfusion. And it's packed with all the good stuff, iron, oxygen, and stem cells, all delivered perfectly and naturally by the placenta. And the protocol itself? It's beautifully simple. The baby is born, and they're placed right on the mother's chest, skin to skin. While that cord is still attached and pulsing away, the medical team can do all the initial stuff, like gently drying and stimulating the baby. It's only after at least 30 seconds have passed, or once those pulsations have stopped, that the cord finally gets clamped. So simple, but so revolutionary. Now, as absolutely crucial as delayed cord clamping is, it's really just one part of the puzzle. It's a piece of a whole system of care that's designed to protect that newborn during the super vulnerable first hour. So first up is thermoregulation. Fancy word, but it just means keeping the baby warm. And this is non-negotiable. For a preemie, a drop of just 1 single degree Celsius in their body temperature can increase the risk of dying by a staggering 28%. I mean, think about that. So golden hour protocols are strict. The delivery room is kept warm between 23 and 25 degrees Celsius, and that baby is placed skin to skin with mom immediately. It's nature's perfect incubator. Next up is helping the baby breathe, and here the guiding rule is less is more. The whole goal is to just gently help the baby's lungs get going without causing any injury. That means using non-invasive support whenever possible, like a CPAP machine. And, this is important, starting with low levels of oxygen, basically the same as the air we breathe. You might think blasting a newborn with 100% oxygen is a good idea, but it can actually be toxic to their delicate developing lungs. And finally, we have nutrition and stability. For newborns who are at high risk, this often means getting an IV line started quickly.
This is a crucial safety net. It delivers glucose to prevent a dangerous drop in blood sugar, provides fluids to keep them stable, and it's all about giving them that essential foundation they need to navigate those first critical moments outside the womb.
So, we've got these three powerful pillars of care, right? But they all rest on one single foundation. You can have the best science in the world, the fanciest equipment, but it all means nothing without effective teamwork. Just look at these numbers. They're shocking, really. A major study found that an incredible 72% of harmful events or deaths in neonatal care were linked directly to failures in team communication and coordination. So a well-organized team that's talking to each other effectively isn't just a nice to have, it is the single most important factor for success, period. When you get right down to it, the golden hour isn't just a checklist of things to do. It's more like a highly coordinated performance by a whole team, where every single person knows their role before the baby is even born. The doctor, the nurses, the respiratory therapist, everyone has to work in perfect harmony. And that leaves us with a really powerful thought to chew on. The golden hour proves that a simple, coordinated set of actions, when they're done consistently in a really short window of time, can have a positive impact that lasts a lifetime. It really makes you wonder, doesn't it? What other simple, powerful practices are we overlooking? Not just in medicine, but, in all parts of our lives.